Hello, San Diego. What did you do in 2020? Well, I can tell you here at St. Paul's, we had a very busy and challenging year. We served over 1,400 seniors with 650 staff, and we kept everybody safe and secure. With the support of our wonderful boards of directors, our donors, and our volunteers, we have successfully concluded 12 months of COVID pandemic. We could not have done it without our staff, and we could not have done it without our seniors who were willing to meet the challenges. And in the following video, you will see how we did that. And we did it while we had fun.
Thank you, Cheryl. On March 2nd, 2020, leadership initiated daily meetings to monitor the spread and make necessary decisions on safety protocols. Every day, staff monitored the CDC guidelines, local and state public health agency updates, and updated the infection control protocols accordingly. A St. Paul's super clinical team was established to navigate critical decisions and established processes. St. Paul's closed residential buildings to the public and initiated screenings ahead of the county orders. Soon after, they added weekly surveillance testing. Employees, seniors, and their family members received letters, emails, phone calls, and video updates. St. Paul's provided San Diegans education countywide. Representatives from St. Paul's were on television several times a week.
Residents and staff at St. Paul's Living Facility in downtown San Diego lined up to receive the Pfizer COVID-19 vaccine this morning.
Joining us now to talk about the distribution process is the CEO of St. Paul's Senior Services, Cheryl Wilson. Hi, Cheryl. Thanks for joining us.
They also educated staff on best practices, hosted town halls, and provided training literature. Signage about safe practices was installed at all communities, reminding all to wear masks, wash hands, and socially distance. Residents, staff, and friends of St. Paul's made face masks, and we swiftly stocked and distributed PPE and N95 masks. Resident meals were delivered to avoid communal gathering. Facilities upgraded HVAC filtration systems and installed HEPA air purification systems, and also installed clear safety screens. A third-party sanitation company provided thorough disinfection and cleaning processes. High-tech screening systems were purchased, and St. Paul's established a second screening process for at-risk situations. For guest visits, safe stations were set up outside the buildings. St. Paul's also provided technology for remote visits with family and medical professionals. They also enhanced information and technology systems so those who could work remotely could do so. They assigned experienced contract tracing staff to successfully track exposures. Chaplains provided counseling for both seniors and staff, and they recorded weekly services.
O come, all ye faithful, joyful and triumphant.
For PACE participants, they developed a roving medical clinic to bring services to homebound seniors.
The roving clinic is the future of medical care here at St. Paul's PACE. Although it has been a good resource during the pandemic, I think the future should continue in that direction.
They also added weekend dental clinics, telehealth appointments, supplied food, did wellness calls, and expanded home care services.
Paul's PACE is an all-inclusive program for seniors, and one of the services they offer is grocery shopping.
Hi, Connie. Hi. We're back.
Fully staffed transitional units were established at several buildings, so seniors had a safe home to recuperate in after a hospitalization. To keep both residents and employees engaged, they hosted many socially appropriate events, and the community got involved by donating entertaining supplies, cards, letters, and pet rocks. St. Paul's recognized immediately that employees needed additional support, so when schools closed, they opened a child watch program and learning lab for children. We provided staff meals so employees didn't have to leave the building to purchase food, created staff shower facilities to use as needed, provided hotel rooms for staff who worked in transitional units, and created care kits for staff who were recuperating at home due to COVID-19. To brighten spirits, St. Paul's sent daily wellness messages with comforting tips, spiritual reminders, and love. And thanks to the St. Paul's Senior Services Board of Directors, staff received gift cards, treats, and even Thanksgiving turkeys. On December 30th, 2020, St. Paul's initiated their first vaccination clinic at McCall's Health Centre, where both staff and residents received their first of 2 Pfizer vaccinations. St. Paul's was one of the first senior communities to do this, and they were featured on 8 television stations.
St. Paul's here teamed up with CVS to administer the vaccine at all of their facilities.
A senior living facility in Bankers Hill is among the first in San Diego County to vaccinate its residents and employees.
As of March 1st, 2021, 97% of our seniors and 87% of staff have received vaccinations against COVID-19. St. Paul's even went to low-income areas to vaccinate seniors who had no ability to get to a clinic.
So as you can see, the many hands of St. Paul's has made for very light work and some fun along the way. I want to thank all of our St. Paul's employees. You have been absolutely amazing. Our board of directors who have been supportive, always there when we needed them, our donors, our contributors, our volunteers. We could not have gotten through this 12 months without you. The team here is so grateful for the community support, and together we all work together to defeat COVID-19 at St. Paul's. And now as we come out of this pandemic, I want to wish all of you a very wonderful 2021 of re-engaging with your loved ones, your friends, and life in general. Take care and God bless you all. Thank you.